pregnancy is considered a very unique part of one's life, to an extent that in most families, pregnancy and childbirth is considered as a rebirth for the mother. Just a single cell in the mother's body from the ovary has just transforming into a 3 kilogram baby. For this, we normally divide the pregnancy into 3 stages and what we call it as 3 trimesters. The first 3 months is very crucial because that is when the organs are formed, and after that, the next 3 months it is the growth in the organs and development of the organs, and the last 3 months is just an modification of the entire system in such a way that the baby gets the additional fat and gets a cuddleable form and is ready for life outside the uterus. So in the first 3 months, many parents would advise their youngsters to be very careful, especially during the first 3 months with respect to intake of medicines, with respect to exposure to certain radiations, etc. So it is only a phase where the organ system are being formed. That is why these precautions may be advised. And in fact, it is necessary that we take care of all these precautions, but there is no need for any fear to be associated with. The next 3 months is the most enjoyable phase of pregnancy, because that is when the nausea associated with morning sickness disappears, and the mother also starts feeling the uterus coming up straight just above her mons pubis, that is the pelvic bone. And that is when she starts realizing that she is pregnant, and during these 3 months only the mother starts feeling the movement of the baby within the uterus. Initially it starts as a very mild butterfly like movement, and slowly it progresses into an active movement perceived by the mother. It is something the men should really feel sad that they are not able to experience, because this movement of a life within the mother's body is an amazing experience, and any mother would like to go through it any number of times if it is not associated with many other issues. The last 3 months is the phase where the mother starts feeling the presence of the baby because of active movements, and also there is a rhythm that is establishing with respect to the mother and the baby as a pair. So the baby sleeps, the mother sleeps, or the baby is active when the mother is asleep, and there are so many movements which the mother can identify at different parts of the day, as well as the baby will be able to identify the mother's emotions, and the baby's movements differs with mother's emotions. So that is the reason the last 3 months is normally accompanied with rest in the form of leave before the delivery, or movement into the parents' place where they get a lot more attention and rest. So that way the mother feels at peace. And towards the end of pregnancy, it can be a very restless phase for the mother, because the baby is quite heavy and it becomes difficult for the mother to sleep in one position, and the sleep may be disturbed very often all through the night. In fact, how we look at it is, this is a very physiological way in which the nature is preparing the mother to face sleepless nights once the baby is born. That is why the last 3 months of pregnancy may be accompanied with a little sleeplessness due to physical discomfort, and I think every mother should accommodate that sleeplessness as a preparation for the early phase of childbirth. So that way, pregnancy is absolutely a physiological process where the body is getting ready to support a baby outside once the baby is born.